That's our
Director, our DHO, Protocol Observer. Good morning, team.
Fine, thank you.
We are here briefly to have the commission of Uganda Care Part building. This building was extended from that entry point toward the other side, and inside, in the interior part, we have some clinical rooms, we have washrooms, and we have dispensing room. So that is the extension of the gun. And then we did a renovation of the entire block. From the other end, up and inside, as you're going to see, we did some renovation of the existing structure. So at this juncture, ladies and gentlemen, I think we allow the commission and the team to commission the building.
A few comments. Yes, about this organization, AIDS Healthcare Foundation. Today we are commemorating the International Condom Day, but then we are asking ourselves, why are we here? So AHF is AIDS Healthcare Foundation. It's based in Los Angeles, USA. It's one of the biggest HIV services organizations. It began operation in 1995 when ARVs were made available. So the core business of AHF is care and treatment. And so in care and treatment, there are certain things that we look at. The patient, environment where the patient is served, and other things. So in Uganda, we began in 2002 at Masaka Regional Referral Hospital. So we began expanding. I think from Masaka, we moved it to Rakai. Then from Rakai, we came here in 2004. So HF has been supporting care and treatment here for the last how many years are those? Those are 20. Yes, 2020, I think in April. So we have been supporting this clinic, certainly. The way we work with the Ministry of Health at Regional Referral Hospital. They give the organization an open hand to begin providing care and treatment. And so when you go to Masaka Regional Referral Hospital, you find, I think the building that welcomes you is the art clinic. So in that sense, we've been trying to, where resources are available, we mobilize resources with the government and ensure that we improve the services where clients are served. So this clinic, before we expanded, there is a scenario that the MS has not talked about. Clinicians, we are sharing rooms, and that compromises, the confidentiality of the clients, but also the staff themselves. So with that, we came here, we moved, DHO is here, we said, what can we do? And I want to thank the MS, it took us serious because we said, as a local government, you need to make a contribution. And so I want to say that the contribution that we asked the local government to contribute was actually made. So we added on 3 clinical rooms, as our regional director said, and then which are than 3 clinical rooms, a shower room, and then a waiting place there that you will see. Before that, clients were, clumped over there, and it was difficult. So this is the type of care that we provide as Uganda Care. In terms of funds, I would say direct construction cost is around 119 million, and then local government, Lyantonde was able to raise 9.6.
Yes.
So that's a contribution. So we are saying IHF collaborates with the Ministry of Health, and that has happened for the last 23 or 24 years. So we are glad to have this one added to the so many works that we have done as IHF. So I think with that, we can now go and dedicate the new structure to our clients.
and On behalf of the NRM government led by Mzee Yoweri Museveni, our president, we appreciate the support of our partners. They add on the efforts of government to reach out to our people. And so we thank you, Uganda Cares. We thank the Lyantonde District local government. That contribution is not a simple one, because we know wakutera ekyakwise abatakutiinira
akola atya?
akukuba n'akatono kalina abatakutidde. So we appreciate, because that is the government contribution. But you see, Uganda Cares came on the scene when HIV had just started, and it has been a long walk in the response to HIV/AIDS epidemic. And now we are talking of ending HIV as a public health problem by 2030. How many years from now? Within 6 years, we want to see HIV no longer a public health problem. So we are opening this facility for care and treatment, but also we shouldn't be reaching here if we had prevented HIV in the first place. And so today, as we commemorate even the International Condom Day, we should be thinking about prevention is better than cure. But those who go beyond and get sick, then we come here and get the best of the care that the government of Uganda is providing you. Thank you, our partner. We appreciate the support. Yes. The Lyantonde Hospital Art Clinic. Expansion of the Lyantonde Hospital Art Clinic is funded by AIDS Healthcare Foundation, Uganda Cares, in partnership with the Lyantonde District Local Government, and is officially opened on this day, 13th February 2024, commissioned by Dr. Atwine Diana, Permanent Secretary, Minister of Health, whom I'm representing. On behalf of the NRM government, led by His Excellency Yoweri Museveni, and on behalf of the Minister of Health, we open this art clinic to serve the Ugandan people.
Dr. Shiza,
Dr. Sid, sorry, here. The patient, sorry, here. Yes, so Dr. C will help and read the roles of the healthcare provider at the facility, and then the roles of the patient. And this is my care plan that we came up with that is supposed to guide. So it's like a commitment for the provider and then the client. So maybe Dr. C will help us read so that everyone
My care plan, the promise by the health providers to support, educate, guide, provide care and treatment to help me attain my health and wellness goals. So the healthcare provider will serve me with respect and ensure confidentiality, involve me in decisions regarding my care and treatment, guide me on the available prevention and care options, register me in the most convenient site or clinic for long-time care, and provide me with current information to enable me to take care of myself. Oh, sorry, that was wrong. Then my role as the client, I'm reading on behalf of Sarah here. My role as the client, I promise to keep clinic appointments, provide full information related to my health, maintain a positive mental attitude, and seek to help other clients, fully participate in my care treatment process like support groups, be respectful to other clients, and healthcare providers and maintain confidentiality. So for the client representative, we have one of our clients here who is called Nakano Agisara. She is going to sign.
Ogezagezako n'ebitundu ebirala ndowooza kyova olaba kondomu eyo tuyinza kuba nga tuli ku pasenti eringa ku 5.6 bwe mazijjukira bulungi mu bantu abakozesa kondomu so olaba tukyali wansi nnyo era kyova olaba olunaku luno balolese wano okugezaako okutegeeza abana Lyantonde okwambala kondomu okugezaako okwekuuma obulwadde bwa mukenenya ate nga bwe mbagambye pasenti yaffe eya kondo eya HIV wano mu Lyantonde ekyali waggulu agambye eri ku butundu 10.6 kati ng'esinga y'eggwanga eri ku 5 n'obutundu ndowooza nga 4 so ekitegeeza ng'enkozesa ya kondomu wano ekyali wansi abantu enzikiriza okukozesa kondomu ekyali wansi nnyo kino obukozi kiteeka obulabe nnyo bungi ku disitulikiti kubanga kitegeeza nti abantu bata twejumbudde mu kwekuuma especially okwambala kondomu oba okuleka okwegatta n'abantu abatali bakyala baffe kitegeeza kyongera okufuna akawuka ka mukenenya kati ekyo kiba kikosa disitulikiti mu byenyingiza mu by'okusoma ne mu bintu byonna ebyobulamu. The percentages of condoms here in the district, I think it is at 5.3%, which is very low compared to other districts. The condom use uptake, condom uptake here in the district, it is still very low. It is at around 3.4%, which is very compared to other districts or compared to other parts of the country. So we need more sensitization and creating community awareness and even encouraging the use of condom as one of ways of preventing ourselves from contracting HIV. Of course, it is that one puts the district at a risk because when you are not healthy, it means you are economically you are not also you are affected, and socially you are also affected. And at the end of the day, the district will be affected in all spheres of life.
HIV. So it is cost effective for the government to provide funding for the condom because it will be reducing a lot of new infections, and once these infections come in, it's a high burden for the clients but also for the government because you need to sustain these clients on treatment for life. Henry Magara, the Country Program Director for HF Uganda Cares.
Nyimiridde wano okwebaza Katonda olunaku luno era nyimiriddewo olwa mukadde wange Lumaama tasobodde kubeerawo olw'emirimu egimu naye nange neebaza kubanga olunaku luno olugenda ddala mu minisitule yange gyentwala ey'ekikula ky'abantu ye mwami n'omukyala okulaba nti babeera balamu n'omwana awamu n'abantu ba Buganda. Nga bwe mukimanyi bulungi omwaka guno tutwalira ddala nga Buganda omulamwa twaguteeka ku ndwadde ya mukenenya era tuteekamu nnyo amaanyi n'okulabira ddala nti tugobera ddala mukenenya mu bantu baffe aba Buganda. Era Ssaabasajja yatutuma temunaagendanga wonna oba mbaga oba lumbe mwogere ku kigambo mukenenya. Naffe yenjiri n'okusomesa n'okuteekamu amaanyi okulaba nti mukenenya tumugoba mu ggwanga lyaffe. Nja kwebaza abateeseteese olunaku luno n'okusinga olunaku olwa kondomu abasinga the guest of honor abasinga kondomu bazeerabira bazimanyi gyeziri naye bamanyi tezikyakola kubanga eddagala lyajja. Oluusi weesanga nti ne kondomu tajjukira nti agenda gikozesa. Era nkuloopera nti n'abamu ku basajja n'abaami abali wano abasajja ba Kabaka nti kondomu bazitya nti bw'ajambala temuyisa bulungi biggwa mangu oyagala kumufiirako so olwekyo nti nakyo twongere okukimatiza abasajja nti baleke kuba n'omululu kufiira ku muntu, agende eyo sitaani bw'aba amuyise nga tali mukyala we asobole okulaba nti akola ekyo amale essaawa zagende. Naye twagala kwebaza olw'enteekateeka ezo mukoze, ate naffe nga Buganda tekitudde tubakwatirako, kubanga omuntu gwe twagala okubeera omulamu wa Buganda ate wa Uganda yonna. Naffe nga Buganda Ssaabasajja yatutuma nti mugende mugambe abantu nti bakwese kondomu atasobola kwekuuma, oba akwese engeri endala. Waliwo endala batusomesa, waliwo empeke, pureepu, peepu n'ebirala byababeera batusomesa bulijjo. So naffe nga Buganda tweyanziza nnyo okulaba nti mulwadde omukisa guno bwe mutuyita naffe teekayo eddoboozi, tuba tukola naffe okumanya nti twongerako eddoboozi lyaffe nga Buganda. Era tukola nnyo okulaba nti naffe abantu baffe babeera balamu, sisiriimu yekka, naye endwadde endala kansa, waliwo sukaali, puresha n'abantu abalala. Mwongeremu n'okusomesa abantu okukola omubiri ogwo gukozesa nnyo okulaba nti tegejja negweyongera. Abamu abalwadde ate bwobeera ku mpeke ezo n'osobola otakola exercise eyo, nakyo kiyiza okuyisa nekireeta endwadde endala nga puresha n'ebirala. Era nga Buganda njaga okutegeeza omugenyi waffe omukulu nti wano twasobola okumobilizinga nga Buganda era nga Kabula ng'essaza lino erya Ssaabasajja nga lukulemberwa Oweekitiibwa Lumaama, twasobola okukunga abantu ba Buganda abali wano n'abali mu magombolola gonna agatwala disitulikiti eno okugaba omusaayi. Era twasobola okugaba lipusi eziwera 318 mu ssaza lino erya Ssaabasajja ery'e Kabula. Era kyali kipya, twakola nnyo okulaba nti kubanga waliwo twatuukanga nga bagamba okuyeesagama nti mayisa ki ng'olaba nti kipya, naye kati kyemanyi oluddako nti naffe tulina okulaba nti twongera amaanyi gabe tufuna lipusi zezo ze twetaaga. Sijjajja okulwa ku bigambo, naye ffe nga Buganda twagala nnyo essaawa, era bwe ntuuse wano ssaawa 2 n'enkuuma mpaka ssaawa 6, bwe zibeera 5 zibeera 5, bwe zibeera 2 zibeera 2. Twakwebaza nnyo, mwebale nnyo, mwebale mbagaliza ekiseera ekirungi. Ssaabasajja Kabaka awangaale. Amanya gange tutibwa Reverend Abel Katumbuuka akulira ekikula ky'abantu mu ssaza lyo Kabula. Eyanza nnyo, tweyanzire.
Thank you, our MC today. Our guest of honor and my boss, Mr. Patrick, Dr. Patrick Sine, the team you have come with from Ministry of Health, the RDC Lyantonde, the Deputy RDC, Chairperson LC5, Chief Administrative Officer, our Secretary for Health and Education, all honorable district councillors present, and our chairpersons LC3 who are invited, also some county chiefs, clergy, ladies and gentlemen, protocol observed. First of all, I made my speech in hard copy so that our chief guest can take a copy back, and the issues raised would pray that he also deals with them in one way or the other. On behalf of the district and on my own behalf, allow me to report on the health service delivery in the district. Lyantonde as a district was carved out of Rakai. That was in 2006. And it is former Kabula sub-county, sub-district. The district consists of 6 sub-counties and 2 town councils, namely Chinonka, Kalirompo, Mude, Kasaga, Malaya, Kajira, Lyantonde Town Council, and the Kaliro Town Council, with a total of 30 parishes, 250 villages. The district has a total projected population of 125,889. Of these, we expect that 25,607 are expected women in childbearing age, and 6,339 are expected number of pregnancies in the district. 5,451 are expected number of children under 1 year, and 25,607 are expected number of children under 5 years. We still have an issue with TB. We are still getting some cases of TB, and we expect to get 381 TB cases this year. And we expect 57,552 people who to be above 18 years. I want to talk about our implementing partners, because much as we talk about them in a sweeping overweight, they have contributed a great deal in health service delivery in the district. We have Infectious Diseases Institute, which is our key implementing partner in HIV activities. Then we have Organization of Community Empowerment. We thank you very much for the services you are giving us. Rakobao, and then we have Mayanja Memorial Hospital Foundation, Salama Shield, and Uganda Cares. Uganda Cares, actually, I want to thank them very much for the effort that they have put in for creating this awareness and this function. I would like to thank them very much. And then we also have MAPI. MAPI is Most at Risk Population Initiative, which is based in Mulago. The district health facility profile. We have one district hospital. We want to thank the ministry for intending to upgrade one of our health center 3s to health center 4, because we have been grappling with the issue of having one district hospital which is far from the services from the community. So we want to thank the ministry for that. We have no health center 4 as of now. We have 6 health center 3s, 2 which are newly built, and they are built with the Egypt funding and Ministry of Health support. We have the 12 health center 2s. In total, government health facilities are 18 plus 1 prison health center 2, which make it 19. I want to go through the list of the health facilities. These are the reporting health facilities that I've outlined in the presentation. Our chief guest, we have a sub-county without the health center 3. As per Ministry of Health Policy, we are supposed to have a health center 3 at every sub-county. So we don't have a health center 3 in Kaliro, rural sub-county in Lyantonde. Human resources for health, the district staffing levels, we are at 76. We're at 76, and we cannot recruit because there was a ban recently on recruitment. I hope we'll get to be given a leeway to recruit, because we are not doing very well in our staffing levels. We have a critical staffing need in the hospital. We need medical officer special grades. We have pediatrics, we have surgery. We have 1 medical officer special grades, obs-gynae. So at least we are lucky. He was trained while he was still a member here, and he came back and was promoted to medical officer special grade. We lack midwives, laboratory staff, pharmacists, dental surgeon, and nutritionists. And we also lack the principal medical officer. Hopefully, our senior medical officer will be promoted once we are given, we are allowed to recruit. Now I will go to the gist of the matter, what has brought us today. HIV and STD burden. The prevalence of HIV is still high in Lyantonde. Some 1.5 to 2 years back, we were reporting an HIV prevalence of 11.2%, but recently, Uganda Population-Based HIV Impact Assessment, UFIA, put us at 10.1%. Now, compared to the national, our HIV prevalence is very high. The national one is 5.1. And the region which we are in, it is at 6.5. So we still have a grappling problem with HIV in Lyantonde. And as the chairperson LC1 put it, we have a very serious issue. We have, they call them NEPO. These days we want to sugarcoat it and not call them commercial sex workers. But the truckers, commercial sex workers, this is a one-stop area where commercial sex is transacted. And we have heard with worrying news that the price of engaging with a commercial sex worker with no condom yields more in terms of the pay. If you don't put on a condom, you pay me more. And that has been the song. So we want to see that we drive, make sure that this kind of attitude is reduced and we promote condom use. HIV people who are active on Earth are 8,037, and majority are with Uganda Cares in that new infrastructure that you saw. They are being managed. The first line are 7,653, second line are 380, third line are 4. Retention in care is still low. We are at 68%. We have a very highly mobile population. We have people who are brought from outside the district and are working in farms. You know, this is mainly a cattle corridor. We have the commercial sex workers who, after a long stint of stay, need to move on because they have been identified. They go and are looked at as new catches in other places. So that mobile population is what gives us a very big problem. Now, as we gear for eradicating HIV as a public health threat, we are also, as a district, targeting the 95-95-95 UNAIDS strategy, and also which was adopted by Uganda Ministry of Health. 95% of persons with HIV knowing their status, we are still at 84%, which is a bit low. But I can assure you that by middle end of this year, we'll have improved because we have started testing people seriously. 95% of people with HIV started on Earth. We are at 92%, and we believe that we will have hit the 95 mark by the end of this year. And we are doing well via the 95% of persons on Earth virus suppression. Virus suppression is at 98%. We also have a problem with STDs. But I would like to say that the information that comes from our DHIS2 is mainly of our health facilities, government health facilities. We have managed to put in our system, we have managed to include some drug shops and some clinics. But we have a problem that their reporting is very, very bad. So we go in and try and train them, but we are still struggling with them. So people with urethral discharge were 352, genital ulcers were 177, and with other sexually transmitted infections we were at 1,778. In total, 2,307 people were treated for STDs in 2023. We need to note that most STIs which are managed in clinics are not entered in DHIS2, as some clinics and drug shops don't report. But we are still working hand in hand with them to see that most of the drug shops are brought on board. Last year we gave out 40,320 pieces of condoms, but you can see this is small. This is a small amount, a small number of condoms which are distributed. And they are distributed mainly in the Lyantonde Town Council. All lodges and most bars have dispensing condom dispensers. As this one was initiated by RHSP, our former implementing partner. It's continued, we have continued having engagement with IDI, and we will see those who don't have, if we can cascade them to lower town boards or trading centers. High condom day celebration. From the above statistics, we have a high burden of HIV and STDs, and it is clear that condom use is one of the preventive measures for HIV transmission, STDs, and unwanted pregnancy. If condoms are used consistently and correctly, there will be a significant drop in HIV and STD rates in the district. I would like to thank the ministry once again for the support it has given the district. We have a new health center 3 which has been built recently in Kabetemere. We have construction of staff house at the Akajo Health Center 3. We have Mpomode Health Center 3 in plan to be upgraded to Health Center 4 this financial year. We have construction of maternity ward in Chinoka using PHC development funds. We have construction of maternity ward at Kabatema by our Honorable Pauline Chaka. There is Kabatema staff house to be constructed in this financial year. The contractors have already placed their bids and they are going to start work. Then there is Kabatema Health Center 3 has been fully equipped. Fully equipped meaning that we can, at the level of Health Center 3, it is able to function. So we want to thank the government of Uganda and also the Ministry of Health for guiding for the assistance that we render to the district. We have mixed and the challenges we have mixed and misconceptions about condoms and condom use. We have also cultural and religious beliefs hindering use of condoms. Those are the two main issues that we have. I can't go on without talking about the staff accommodation, Mr. Commissioner, sir. We have a low staff accommodation. 80% of staff reside outside the hospital premises or the health facility premises. So you find in some areas there are no clear habitable housing, so they walk distances to go and serve the people they serve. We also have a need for an emergency center, or emergency outlet, because you realize that we are on the highway, and the number of accidents we get per year are quite a number. The crash victims, the traumatic injuries we get, they are quite a number, and this has put pressure on our hospital, and we don't have a proper emergency wing. It's just one small room which can barely accommodate 3 people, and which we use as an emergency unit. We have been praying about the mortuary. We have unclaimed bodies. We have people who have died in accidents. We have our own cases which die in the hospital. We have other cases from out there which come in for postmortem, and we don't have where to store these bodies. The mortuary that we have has an issue. It is a very small building. It can barely accommodate 2 bodies. And even doing an autopsy from that building is quite a difficult thing for health workers. We have frequent stockouts, and we want to thank NMS for trying, but we need some bit of more pulling up of their socks, because we have had a stockout in the hospital for the last 2 to 3 months, and it has been quite a problem. Acknowledgements. I've already thanked the government of Uganda, the NRM government, Ministry of Health for the continued support in the services we render to the district. The district leadership is appreciated for the continued support and prompt payment to contractors. RDC's office is appreciated for the supervision and guidance, and our implementing partners that I've mentioned before. Thank you very much. With these few remarks, I'd like to end here and wish you good deliberations. Thank you very much.
Thank you, DHO, for the informative speech. Bado njagala okukora mu summary butono nga mbuza mu Uganda. Bupando zenkyali nawo. DHO mu speech yagambye nti ebbeeyi eya bannekolera jange mu tawuni nga toyambadde ya babbeeyi nnyo okusinga ng'oyambadde. Era ekyo kibatiisa ng'abo ebyobulamu, kuba ate abeebakana n'abannekolera jange nga tebambadde, ate abo bakola nnyo okusinga abambadde. Agambye nti retention in care, nti abantu ababeera ku ddagala babatawaanya, kuba omuntu abeera ku ddagala leero wano enkeera n'asenguka n'agenda Bwengu, tebamanya oba ate Bwengu akyali ku ddagala oba alivuddeko. So batawaana nnyo okumanya oba abantu bano basigalira ddala ku ddagala oba bwe bava wano balivaako. So okusigala ku ddagala kikyali kizibu kinene. Agambye nti prevalence obulwadde nga bwe buli mu ggwanga, nti mu Lyantonde wano ffe tuli ku butundu 10. ate mu region eno ya Masaka tuli ku butundu 6 ku buli 100 ate eggwanga ng'eggwanga liyimiridde ku butundu 5 ekyo nno kiraga nti tukola bubi era tugezeeko okwekuuma.
Without fear of favor, I may necessarily not have a speech to make. I only want to appreciate the following. I do thank the Uganda Cares, Lyantonde here, staff, who actually spearheaded the mobilization and the walking for today and all this. Can we clap for them? I extend my appreciation, the support from the Minister of Health in terms of preparing for this International Condom Day. I thank you very much. Can we extend a clap of to the ministry officials? Maybe other than the chief guest, those who have represented the ministry, can you stand up for recognition? The ministry team. Thank you very much for supporting us. I want to thank tirelessly the DHO and his team. Maybe you may stand up for recognition and the whole planning. In a special note, I want to thank the RDC who have been co-chairing this and organizing for, in the absence of the Minister of Health. He has done it to the best. I recognize you. I have only one observation and to make. It's true that condom saves us from HIV and AIDS, but I also encourage that the population growth rate, I'm worried. Can we use it more effectively to protect the STDs and the HIV and related issues, but most importantly, not to make children accidentally? Let us use a condom to prevent having children accidentally, that they end up either on the streets or engaging in other sex, as our case in Lyantonde, it stands. Last but not least, there is also, other than enjoyment, as some person mentioned it is just a matter of your attitude. A condom is like using a cutlery. Whoever is accustomed to using hands, when he touches a fork, he will not feel satisfied. But he will finish the same amount of food as you, but still he will remain unsatisfied. So the condom use is like that. It's just an attitude. Yes? Just accept it, and then, like you are putting on your gumboots, you are safe to pass through the swamp and the bushes without you being injured. There is also a silent killer that condom can protect us, the hepatitis B and C, because of movement of these vehicles we normally have here, the long distance drivers. I'm not very sure with statistics, but I'm worried there may be a high increase of hepatitis B, because one of the forms of transmission is through sex. So condom use may protect you from that, and you know, it's a dangerous one. It's not easy to treat. Actually, it causes most of the liver cancers. The doctors are here, they know it better. So with all these many words, I wish you the best celebrations. I must recognize and thank the band. Can we clap for the band, the young team? They made us enjoy the walk, and they have helped us to burn unuseful and useless calories that we have been storing. We are now more healthier and fit. I thank you, and I'm looking forward to seeing you participate at the end and the close until the guest of honor releases us. I thank you. I say this for God and my country.
Amanyango ya Lozius HIV Subsidies yenkola gye tutambuliramu akawuka kakome kwoyo akalina. Z'omu ku baana abaazaalibwa n'akawuka mu mwaka gwa 1984. Mukama mulungi nkyaliwo, naawe okyaliwo, weekubire mu ngalo. Neebaza Katonda olw'ekitongole kya Uganda Care, kubanga nze ebiseera ebyasooka nayingira Taso n'okutandika eddagala ly'akawuka, Uganda Care yasooka okuleeta eddagala ate ku bwereere erya ARVs. Nze omu ku nsi yali tasuubirwa nti nnyinza okukula, naye Mukama mulungi, nkuze era wende. Nina n'omwana atalina kawuka. Omulamu ogwaleero omukulu kwe ku enkozesa y'akapiira engeri tuyinza okwewalamu akawuka ka mukenenya eri abatannakakwatibwa. Naye ebiseera ebisinga tulina endowooza gye tukayinako nti akawuka yes kakuwa ebbanga mu kuzaala kwani kw'omwana okuwawa amabanga. Naye waliwo ensonga endala. Mukimanyi nti akawuka akapiira katuyambako okuyamba maama obutafiirwa baana bazaala ng'afunye endwadde z'obukaba. Ekyo tukimanyi bulungi. Akawuka akapiira y'ensonga lwaki singa tukakozesa obulungi kagenda tuyambako bamaama okuzaala abaana ng'ate balamu bulungi. Tukimanyi endwadde ezikwatagana mu bitundu ebyo zireetera bamaama okuvaamu embuto. Singa tukozesa bulungi akapiira eri oyo akakozesezza obulungi okutaasa ate obutasiiga muntu mulala. Nga ngenda maaso ku ddagala lya ARVs nalitandika mu 2004 ku Uganda Care. Abasawo mbeebaza banyamba okubeera nti mbeerawo. Omusawo yatandise eddagala aŋŋamba bw'onaamira obulungi mu muddo obutuufu n'oyagala eddagala ogenda kuwangaala weze n'emyaka ameka? 4. Naye nga tekikkirizibwa kuba akaseera ako tekaali kangu. Ng'oyo yali atuse ku last time erowooza nti omuntu akoze eki? Waliwo abalikyandise ng'enviri zammwe zirabika bulungi, mukubire Mukama mu ngalo, mulabika bulungi. Naye nze nalitandika mu mbeera ewatali ssuubi. Mukama mulungi, nalitandika nga ndikaana n'endimira bulungi. Mu kaseera kano 1984 olowooza nyina emyaka emeka? Nazaalibwa 12 ogw'e12. Era nga 12 ogw'e12 mpeza emyaka ameka? Era nsubira Mukama mulungi, naku olujja kutuuka ye birthday yange gye nja okusooka okukuza, mwenna nsaba mubeerewo nga Katonda yembezi. Nazaala omwana, nafuna omukyala ng'alina akawuka, nga nange nyina akawuka. Lwakubanga sinnamufuna mu biseera by'obuvubuka, abavubuka mulina ebibasoomooza bingi. Bwe mba nyina akawuka ngenda kukola ntya okufuna omwana atalina kawuka? Ng'ate batugamba bwe nnaafuna omwagalwa nga talina kawuka ngenda mumusiiga. Ate bwe nnamusiiga tujja kuzaala omwana alina ki? Akawuka. Endowooza tugirina. Naye Mukama mulungi, abasawo banoonyereza ng'abantu ababiri abalina akawuka singa batambulira mu nkola ya PMTCT eyamba maama okuzaala omwana nga talina kawuka, kituyamba okuzaala omwana omulamu obulungi. Nange yemu ku nkola gye nakozesa okuzaala omwana atalina kawuka ng'ate omukyala alina akawuka. Mukama mulungi, omwana kati akuze emyaka 10 ate nga tuli bafumbo. Katonda mulungi, nkyawangaala era wendi. Naye buno obubaka mbutwala eri okusomesa kituufu, buli omu tusomesezza, naye nkyayagala ebitongole ebikwasaganya ku kawuka. Mu kwongera enjiri tugibunyisizza ne twongera ogikkiriza wansi mu masomero. Abaana abangi abavudde ku ddagala ng'ali ku ssomero tamanyi waalitereka, ali mu mbeera eno. Naye singa essomero mu ggwanga tufunayo omusomesa omu ng'amanyi ku bikwatagana kawuka, ng'omwana oyo asobola singa tumuzuula nti ali mu ssomero bwe riti, tusomuwa omusomesa oyo ng'asobola omugayidinga okumira obulungi eddagala. Esasobola kufuna baana abafeeyiringa ku ddagala, kubanga bangi abavubuka abafiiriddwa obulamu bwabwe naye ng'ate baali badde balamu bulungi. Olw'ensonga ekisaba abakwasaganya kawuka wamu ne bannaffe abasawo b'ekinnansi abasinga obungi tebamanyi, bangi abafiiriddwa obulamu bwabwe nga babafeze, naye ng'ate oluusi singa abadde amanyi yandiyambye omuntu oyo okubeera nti atambulira mu bujjanjabi singa tuba tunyikiza enjiri eyo wansi mu masomero. N'olw'ensonga eyo nebaza Government of Uganda olw'obuyambi bwetuwa ng'abalina akawuka. Uganda Care nebaza okutusapootinga ng'abavubuka, kubanga nze nava mbwana ngenze mbuvubuka gye ndyokera nammwe mumanyiyo. Ngenda mbaki bantu bakulu. N'olw'ensonga eyo amannya nsigadde ngobya Losius, Omukama Katonda abampeera omukisa wamu n'okwongera okufuna omutima ogulumirirwa ng'alina akawuka oli oyo atakayina okumuyamba obutafuna kawuka, kubanga nze akalina byempitamu si byangu okumira empeke buli lunaku.